Please be aware, in this podcast series we talk about all areas of safeguarding, which some people may find upsetting. So please make sure you're okay listening to today's topic. Be mindful of those around you, such as children, that you might not want to listen in. Hi, I'm SSS Safeguarding Director Sam Preston.
And I'm former head teacher and content author Sarah Spinks.
Hi everyone, and welcome back to Safeguarding Conversations, where we explore lots of things that really matter in schools. And today we're discussing autism in education, what it looks like, how it feels for children, and how schools can create environments where autistic learners are not just accommodated, but genuinely they feel safe, included, and valued. And it's really important to say at the outset, neither Sarah or myself, we're not clinical experts in autism, but like many of you, we're professionals trying to respond well in school settings. So we're here to talk about what school staff can practically do day to day with safeguarding always at the core.
Exactly. Because safeguarding isn't just about responding to harm, it's about creating conditions that prevent harm, reduce distress and help every child thrive.
Yeah, autism or ASD it's a developmental condition that affects how children perceive and interact with the world, particularly in areas like communication, sensory processing, emotional regulation, and social understanding.
Yeah, and it's a spectrum condition, which means that no two children present the same. Some may have obvious traits, while others, especially girls, may mask difficulties so effectively that their needs go unnoticed until a point of crisis.
Yeah, and from a safeguarding perspective, this is key. If we don't see the signs, if we don't recognize those signs, we can't respond to them. A child who appears compliant may actually be deeply anxious, overstimulated, or misunderstood.
So I think we really need to ask the question, are we recognizing what a child is really feeling or just what they're managing to hide?
Yeah. So let's look at what staff should be on the lookout for. Early signs include repetitive play or fixed routines, avoidance of eye contact or shared attention, sensory sensitivities or distress, delayed or unusual language patterns, rigid thinking, or strong resistance to change.
Yeah, and from my own experience, I've seen how easy it is to miss these signs, especially in quiet, high achieving pupils. So my daughter mathsed for years, and it wasn't until the sixth form that she began to struggle with things like processing written information at speed, and things were really picked up. She had hypersensitivity to smell and noise, and it was in the sixth form that was noticed. And because she was quiet and shy, it had just gone masked. And I was a head teacher as well, but it was masked so effectively by her for many, many years.
Yeah, and here's the safeguarding challenge. Are we interpreting these behaviours as quirky or disruptive, or are we seeing them as signs of unmet need or distress?
And that shift in mindset is really vital.
Yeah.
Record behaviours over time, look for patterns and crucially, involve the Senko early.
So, Sarah, what does an autism-friendly, safeguarding aware classroom look like?
Well, it's calm, structured, predictable, and it avoids unnecessary sensory stress. Key strategies might include things like having visual timetables and first then boards, pre-warning before transitions, clear, concrete language, low sensory zones and regulation spaces. Even things like your displays. Avoid being over colourful, overstimulated. Keep everything neutral in the background. So it really helps children to process and have calmness at the core of that classroom. Lots of plants, soft furnishings. That environment really helps children who struggle to feel more calm and feel more settled.
Absolutely. So, from a safeguarding point of view, we need to consider, is our environment enabling children to feel secure, or are we almost unknowingly creating triggers that overwhelm them?
Exactly. Small changes like seating position, lighting, or classroom noise, that can make a huge difference. Autism inclusion really is in the detail.
And communication, it isn't always verbal, and that's where safeguarding risk can creep in. If we don't understand how a child communicates, we run that risk of missing disclosure, discomfort, or distress.
I think that's why tools like Makaton, PECs, visual prompts, or devices are vital. And we should always allow for processing time. I think we're too quick to hurry them along when actually they just need that time to process.
So I suppose it's about thinking, are we only listening to spoken language, or are we tuning in to what children show us through their behaviour, their body language, and possibly through withdrawal?
Yeah, and non-verbal communication should be praised and acknowledged, and it's just as valid.
Yeah.
Families are often the first and best source of insight, and they can also be the most exhausted, isolated, or overwhelmed.
Absolutely. So I think, again, we've got to consider if we're truly collaborating with families, or are we just passing the problems by reporting back to them about what an awful day the child's had.
Absolutely. Regular check-ins, even when things are going well, are part of safeguarding. Show that we're holding the child in mind, and that helps build trust. Things like every day as a practicing teacher, I used to go out and speak to my parents every day at the end of the day, and I would say, "Oh, Fred has had a fabulous day today." So the day when you need to go out and say, "Oh, can I just have a word with you about Fred today?" That parent knows they've got trust in you. They know you see the good in their child, as well as those times when we need to work together.
Yeah. And I think also signposting, is essential. Is connecting families with the community pediatricians, speech and language therapy, occupational therapy, autism support organisations, and local parenting networks.
And being aware of those co-occurring conditions like anxiety, ADHD, or sleep disorders, and also their impact on wellness and safety as well, because they often come combined with an ASD diagnosis.
Absolutely. And I think, I mean, I'm sure you've experienced the same, Sarah. I mean, it's certainly come up a lot for me where, you're trying to have conversations and it's, oh, we're waiting for a diagnosis. But, support, you should never wait. And I
Exactly.
appreciate it is very, very difficult in the current situation that we've got with external services support.
Yeah.
Actually, we can't just say, well, we're just leaving things until we get a diagnosis.
Absolutely. So I suppose you could ask that question of what can we put in place now based on need, not paperwork.
Yeah, well, I think there's some very, very practical, sort of things. I mean, gathering. I mean, one of the first things that you'll know when multi-agency professionals become involved, they will ask you to monitor things and they'll ask you to collate information. So get that done so that when you're actually having the contact, you're actually presenting them with the picture. That's going to reduce time. So gather that classroom evidence, use screening tools, involve the SENCO. If you can, the educational psychologists, speech and language therapists, and occupational therapists for sensory needs, although I do appreciate, it is these days, one of my colleagues said, oh, they're rarer than hen's teeth.
Yeah, very much.
And it
so.
often feels,
Absolutely.
it often
It
feels
does.
that way.
Yeah, and it's got worse in recent years. I think, referral pathways often run through neurodevelopmental services led by pediatricians, supported by written reports and observations. So it's, as you say, getting that evidence and getting the evidence in school before you can then go to your other external
Yeah.
services if you can get there.
Yeah, but I think we need to be really clear about the purposefulness of this. This early action is safeguarding, and it needs to be seen within the safeguarding remit, not just the educational progress, that sort of framework. So I think if we frame it within the safeguarding remit, we don't wait for diagnosis in that remit. We offer support, and that support then
Absolutely.
develops as the picture and as other people become involved. It changes and it gets more refined. We wouldn't dream
Absolutely.
in any other aspect of safeguarding. We wouldn't dream of saying, well, we're not going to do anything at the moment because we can't get so-and-so involved. We would put
Yeah.
some form of support in there, wouldn't we?
Absolutely. I'm just thinking meltdowns, refusal, self-injury, or aggression. These aren't naughty behaviors, they're communication. And I
Yeah.
think we need to always be clear about that.
Yeah, they're often those type of communications. They're saying, I'm overwhelmed or I don't feel safe.
Yeah, so I think we need to be really clear, are we punishing behaviors or responding to the needs behind them? I think that's a really key question in this.
Yeah. I mean, I think it's, using ABC charts, identify triggers, train all staff in de-escalation and emotional regulation.
Yeah, things like fidget tools, breathing exercises, sensory breaks. These aren't luxuries, they're sort of protective factors.
Yeah. And I think it's important to say that no one staff member can do this or should be expected to do this alone. And that does happen where this is creating perhaps a difficulty. Or let's get the pastoral team to pick it up, or let's get so and so involved because they've had experience of this in the past. The inclusion of those members of staff is fantastic, but we can't just say, oh, they're dealing with it, if you like. It needs to be an inclusive approach, and it needs to be within that whole school culture.
Yeah, and where schools work together, that always helps as well. Through trust clusters, federations, there's strength in that shared knowledge, co-training staff, sharing sensory resources, creating consistent transition plans, running joint autism friendly events. They are really useful to work in the partnership.
Absolutely. And we've spoken about this before, about how often schools are duplicating the sort of creating things and that effort where perhaps that work's already been done within schools that you can link with. And it's about building shared systems that safeguard and include every child. But,
Yeah. Yeah.
just
You're right, Sam. It's about that. And it's also recognizing, I think, that autistic children have incredible strengths.
Yeah.
Focus, creativity, memory, pattern recognition. They're just naming a few of strengths that autistic children have.
And we've spoken about this, haven't we, Sarah, about the difference between seeing something like autism, seeing it through a deficit lens. We're not good at seeing it as a lens of potential.
Yeah. Or, using interest as the learning hook, for example, celebrating passions, giving children safe spaces to shine.
And I think the other thing that I would like to keep on the radar is that, safeguarding is also about dignity. And when we support children to feel successful and respected, we're reducing risk and we're building resilience in a dignified way.
Absolutely. And an inclusive culture doesn't start with a tick box. It starts
No.
with staff who ask, what does this child need to feel safe, seen, and successful?
And I suppose that leads to an even bigger reflection, considering, are we building systems around the child, or are we asking the child to bend to our systems because that's easier?
Absolutely. I think with the right mindset, training the safeguarding lens, schools can be places where autistic children don't just survive, they flourish.
Absolutely, they flourish. So I'll bring this discussion to end. I'm quite sure we're going to return to this topic, and it would be really interesting to get some feedback. So please do get in touch and let us know your thoughts. And maybe within your teams, just put that question out there. What's one thing we could do differently tomorrow to make our school safer and more inclusive for autistic learners?
And also, Sam, I'd say to listeners, check out our YouTube channel. So our YouTube channel has a really good video on autistic spectrum disorders, which has been developed by Dr. Gwyndaff Williams, who is a GP principal. And I think it's worth watching that.
That's smashing. Thanks for that, Sarah. So thanks for listening, and look forward to seeing you next time.